Hello, and thank you for joining today's webinar. We will be starting in 3 minutes. Hello, and thank you for joining today's webinar. We will be starting in 1 minute. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have disclosed no conflicts of interest. To receive contact hours for this CNE session, participants are required to attend the webinar and complete the evaluation form, which will be emailed to all attendees approximately 3 days after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. To test out this feature, please submit the state or country you are from. We would like to thank Sigma Theta Tau International and the Quality and Safety Education for Nurses for today's collaborative webinar. We would also like to thank our speaker for sharing her expertise with us today. Our speaker is Dr. Kimberly Dunker. Dr. Dunker has been a nurse for over 20 years and has worked in a variety of critical care nursing areas, specializing in adult, surgical, medical, oncology, thoracic, neurology, and cardiac surgeries. Early in her journey, she found her love for teaching as a clinical adjunct faculty, where she worked in several nursing schools, teaching medical surgical clinical rotations in both the ASN and BSN programs. Currently, she is the Dean of Nursing at Fortis Institute in Nashville. Now let's go ahead and get started with today's presentation.
Well, thank you so much for that introduction. Welcome. I'm so glad we can spend tonight together for a little bit and talk a little bit about the program tonight, which is really talking about how do we prepare for this CNEcl exam. And I think it's important because many people ask me all the time, you know, what is the difference between the CNE and the CNEcl? And then how do I prepare for the CNEcl since it's such a new exam? I'm very interested in this. I'm not quite sure which one to go for, which one should I do. So we're going to talk about a little bit so the differences so that you can try to decide which certification will be right for you. Because when we go ahead and sit down for certification, to prepare for certification, we want to make sure that we are preparing for something that's going to not be a stretch for where we are in our practice, in our clinical practice, or in our academic practice. The CNEcl is based, and I'm sure you all know this if you've been preparing, which many of you have, in the NLN Competencies. Okay, and so the thing that we have to look at is we identify the teaching and learning activities based on adult theories and principles. So yes, in the CNEcl, a lot of people say, oh, I don't want to do the CNE because I won't have to learn those educational theories. In the CNEcl, you still have to apply all those theories. So that is something you will have to study for if it wasn't something that you learned in your practice. We're going to go through different criteria for the CNEcl in just a second. The NLN competencies also describe assessment and evaluation. I would say out of the 150 questions that you would get in this actual certification exam, you will definitely have, I would say, probably 20 or 30 of those questions having to do with some kind of an assessment and evaluation, maybe more. A good majority you have to understand and have to be able to answer questions around how do you give feedback, how do you assess and then give feedback to your clinical students. And then the next one is how do we articulate or develop and revise curriculum? Okay, so how do we maintain quality improvement? How do we know a med-surg student that is in clinical is obtaining objectives appropriate for that level, or foundations, or pediatrics? And again, it's going to be set in that academic setting. The other setting that you will see in terms of curriculum is in the clinic setting, in the clinical setting, unit-based orientation, educational curriculum for new grads, and transition theories. That is all going to be composed in curriculum. And then discuss the role of scholarship, service, and leadership. So those are the competencies for NLN, and we'll dive into where those are found in the CNEcl. The goals, according to NLN, is really to distinguish the academic clinical nursing education specialty. It's to give it, something that says, okay, I'm certified just like any other certification. So if you are in clinical practice, if you are a DNP, if you're a nurse practitioner, if you're an adjunct clinical faculty, if you are a nurse educator in clinical practice, this certification would definitely be something that you would want to go for. It also will strengthen the use of your core competencies in academic clinical nursing practice and contribute to academic clinical nurse educators' professional development. Anytime we sit for a certification, that's really the goal. It contributes to our professional development. I put this here because this is directly from the NLN, and we're going to revisit this every few slides, because when you study, it is important for you to break down what these different categories mean. Because in these categories, you will be, there's a percentage allocated to the exam, as you can see. So look down there, we see number 6, implementation, effective clinical assessment and evaluation strategies, 17% of the exam. But if you look at 5, facilitate learner development, so we have to show the students how to develop in that clinical setting, socialize them, and that is anything from mentoring to helping guide and critical think in that environment, and then evaluating them in that process. So I'm going to talk about the difference in evaluation techniques and what's important for that clinical learner. So the academic clinical nurse educator is one that facilitates the learning of nursing students in those clinical components. And that can be a variety of different ways. And we're going to talk about ways we measure critical thinking. Believe it or not, we measure it through cognitive, right? Through the affective and the psychomotor domain. We're going to look at all those different elements. And when I say those different domains in the test, you will have to choose ways where the clinical faculty are seeing this demonstrated. For example, if the exam says you are looking at examining the clinical students in the affective domain, we are looking at things like journals. If we are looking at students assessing them in the cognitive domain, we are looking at things like concept maps. If we look at students assessing them in the psychomotor domain, right, we're looking at how they performed that skill at the bedside. So you will need to match those domains with what's happening in clinical practice. I hope that makes sense. We also want to account them for providing a fair evaluation. Okay, so that is where we link the expected outcomes for that student with the evaluation. And so the questions that you see, remember we said that 17% of that exam is going to be around how do we give good feedback to the student in clinical or the new grad on orientation, right? How are we going to give them feedback in a fair way that allows them to take our feedback and put it into practice while in that setting, in the clinical setting? There are qualifying options, and this is taken directly from the NLN website. So if you want to sit for the exam, you can have option A, which means you meet 1, 2, and 3 of these criteria, right? You have a licensure, you have a graduate degree in nursing education and professional practice. When I've taught graduate students in nursing education that go and sit for these exams, the CNE or the CNEcl, they tend to do well because a lot of their outcomes for their graduate degree are aligned with the criteria. Option B is really for my clinical faculty that have a baccalaureate degree. They don't have a master's in education, but they have been working in practice and they're going to go ahead and get certification. They've been working in academic practice. That key to working in academic practice is important because a lot of the elements on this exam are embedded in that kind of practice. So it would be very challenging if you hadn't had the experience in academia, even those few years and several clinical rotations, if you hadn't had that experience to go ahead and take some of these tests. Now, could you if you're a good test taker? Yes. But a lot of these questions I will tell you, taking both the CNE and CNEcl, they are written very well. So when I say that they're written very well, I mean, you have to, I can tell you for me, it had been over 20 years since I had taken a certification exam like this. And it was hard on my brain to sit there for 150 questions for over several hours, even practicing. I then started feeling what my students who prepare for NCLEX, all that anxiety and stress all came back because I felt like, oh my goodness, I've been teaching for 15 years and this test should be easy. But it truly, I took the CNEcl and then several months later took the CNE, and then several months later took the CNEcl. And I can tell you they're very similar. There's some slight differences, but the high level of testing, the way all the questions are written are so well written. So you have to pay attention to all the little verbs and everything. So it's very hard on your brain when you prepare for a test. It had been many years for me. But I tell you this because how I prepared is, yes, you can go to this. 2019, the candidate book came out. I took the test several months after the test came out. I wanted to get it in while I had just freshly studied for the CNE. If this test had come out earlier, because I'm so embedded in clinical education, I have a DNP, I would have gone and just taken this test. I think it aligns well with my DNP. But at the time it wasn't available. I did, and I would suggest doing the CNE practice test, even though they're not CNEcl, because it really gives you a good idea of how those questions are written, right? So, you know, again, all those questions are going to be, the nurse educator is, say, assisting a learner with the development of critical thinking during pre-conference in the clinical setting. Do you see? It's all around the clinical setting. And the question is going to be something like, it would be most effective if the nurse educator asked the learner to. And so you might have a multiple choice that says, well, you would want them to prioritize. When we ask a student to prioritize their patients, if they have 1 or 2, or prioritize the systems in their patient on their assigned client, that is helping to facilitate critical thinking. So in that question, we are talking about critical thinking. And then in the answers, we're going to look for critical thinking. And again, we teach our students how to do this, but for me, it was like dusting off the cobwebs, really making that STEM and that answer match. So I know we were going to do a few polls here, and I think we can go ahead and do the polls. Okay, so quick poll. I am planning on taking the CNE or the CNEcl exam. Select one of the following. Just try to get an idea of someone. So within thinking about taking it within a year, that's good. Within 6 months, great goals. So this is a really great, I don't know, it's a good question to ask yourself, because I'm going to tell you, I spent a good year, I spent time deciding, and then it was about a year, and then 6 months, and I did the whole thing. I was like, oh, it's a big commitment. It's expensive. Do I have the time to prepare? It was all these things. And I will tell you, I spent some pretty hardcore time preparing for this exam. So you have to think about that. What's going on in your life, and can you dedicate some good study time? Okay, what is your study plan for the CNE or CNEcl? Take a live review course, take an online review course through Sigma, answer lots of practice questions, read the Billings and Halstead book, or all of the above. All right, all the above. So I'm going to tell you, all the above is great. And it's interesting because a lot of people say they're going to take a live review course. And I have taken several just to kind of, as I was preparing, and I wrote the online review course for Sigma. So that course, if some of you haven't looked at it, it is for the CNE, and we will be bringing out the CNEcl. There's 2 more modules that we are just finishing up that should come out, probably in the next few months here. And through that, it is self-paced, so you can go on, and there's lots of practice questions. What I found from taking the exams is I needed a lot of practice questions. And I found that the review course for me was a very passive exercise. Although good information, I still had to put the muscle in. So the review course gave a good outline. But if you do lots of practice questions, and if you go back to that Billing and Halstead book, that's what I did, is I went and I kind of matched it. So when I got a question wrong, I went and studied the question, kind of like you study for NCLEX, looked at the rationale in the book and went back and forth. So I think those are some good strategies. Who should take the CNEcl? Those who work in clinical practice, those who plan to work in academia, those who work with students, those who have a master's in education, all of the above. Yeah, so actually the CNE or the CNEcl would be for either. Okay, so remember I said if the CNEcl had been out sooner, I probably would have gone for that because it aligns very well with my clinical practice. But in academia, you could do the CNEcl or the CNE. They're both very rigorous exams, and they're very similar, honestly. Good. I think this might be the last question. What are the statistics for successfully passing the CNEcl? Do we know? 50%, 60, 70, 80? It's unknown. We don't have that data yet, but it is supposedly will be coming out from the NLN. The statistics for passing the CNE are a little bit above 50%, and what we're seeing is it's a little higher for the CNEcl. And I asked this question to my, I have some colleagues at the NLN, and I think a lot of that has to do with people taking this exam are very well aligned with their Master's in Nursing Education that they had, their DNP. It's very clinically based. So it's a lot less, it's not that there's less theory, but the CNE, if you take that exam, and there's 2 of the chapters, and that is chapters 5 and 6 have to do a lot with change agent, Boyer's models of scholarship, and those areas. And if you don't work in an academic institution that pertains to you, that is very challenging on the CNE, right? Because you aren't evaluated in those methods. So if you work in a program that uses a different form of faculty development and evaluation, then that would be something you'd have to completely learn, and it's not something that you are learning because you're involved in. Good. So the faculty knowledge and skills development, this is the review that will be coming out for Sigma. We have the CNE FKSD that has already come out, and that is you can buy the whole program or course by course, but it is a great guide that we created, and it's very interactive. And what I think, for me, what I took from it when I developed it was really taking that blueprint that we're going to continue to look at of the CNE and the CNEcl, and then put together those questions and those patient scenarios to help you engage in those types of questions to prepare you. Again, when we think about preparing for this exam, we are always thinking about what is that question going to look like? Lots and lots of questions. So when I think about another question, for example, it would best promote learning in the cognitive domain. Okay, so again, we talked about cognitive, psychomotor, and affective domain. Again, cognitive, we are asking students questions and getting them to recall information about something. And it's a very applicable thing to clinical practice. All right. So we have recall. Okay, and recall is, I ask a student in clinical, can you recall the steps to respiratory assessment? And they give you those steps. That's recall. Application is more like, you are caring for a patient with COPD. Talk to me about the priority in their nursing diagnosis and what nursing interventions you will do based on that priority. Okay. Analysis and really evaluation is really synthesizing. Now that you've done all your care on that COPD patient, how will you know that your interventions were effective? Okay, so recall, application, and analysis. And I give you those examples because that is truly the type of questions you will see on that exam. Again, 150 questions, 20 are being tested, so your cut score is 99, okay, and that's a 76. And you can go back and forth, it doesn't shut you out, so you can go through the test back and forth, and we tell our students don't change your answers, but I can tell you I changed my answers, and I was biting my nails when I hit that submit button. Did I pass? And I went and found out. And but yeah, it is a very it is not an easy exam, and it will take you several hours to get through. It's a lot of questions, so it's real important to just, again, exercise your brain. So as we transition, I want to talk a little bit about teachers, because are good teachers simply born, or is it genetic? Okay, can ineffective teachers become better? Can you make a good teacher more effective? So when we think about preparing people, nurses in nursing education, some of what we will discuss in this exam is how to make teachers better. Okay, because there are some people that it's in your genetics. You're just a really good teacher. You're really good with students. You're really good in certain areas. And then there's some people that want to be good teachers, and they go into academia and they want to be better. Same thing with preceptors, right? A good nurse doesn't always make a good preceptor. So sometimes there's training that's involved, okay? You will see questions on orientation and training for clinical faculty, okay? Objectives. I'm telling you, you need to understand what objectives are for that clinical experience, because again, in this exam, you will be asked to match things that the students are doing with objectives, okay? You're going to be asked to say the objectives at this level, the foundations level of the student, does it match or not match, okay? And objectives can be of the level of student, the clinical, the, where they are in their transition. We also need to think about what systems or diseases are that we are focusing on in clinical, and observations. You will get questions on observations and what is appropriate to send students or not, and what does an observation mean when a student goes on observation. Paperwork. A lot of what you see with paperwork on this exam is really, number one, tying to the objectives. Does the paperwork meet objectives? How does evaluation and paperwork match? Okay, and how does the objective, how is it reflected in that final summative evaluation? So you'll see lots of questions on objectives. So just again, reminding us where we're at with this exam. We've talked a little bit about all of this, correct? We've talked about the environment. We've talked about communication and orientation. We've talked about facilitating learning. So again, cognitive, affective, psychomotor domains. How do we do that? And then marrying, what does that look like, matching those two. Function within the education and healthcare environments. How do we function safely? Okay, so safety has to do with evidence-based practice, quality and safety in nursing education, NLN best practices. It has to do with those CCNE, ACEN accreditation standards. That is all has to do with safety and quality in your education. How do we facilitate learner development? And then we're going to talk some more about assessment. Assessment's big. Historically, if you know the material, you can teach it. See one, do one, teach one. I teach the same way I was taught, the ceiling effect. So if you teach the same way that you were taught, was that good or was that bad? I can tell you I had wonderful teachers, but I went to nursing school when I was 18 and I was too afraid to say anything if I had a bad teacher or a good teacher. Today's demographics, they'll tell you what doesn't matter. If you're good, they'll tell you right to your face, a lot of these students. Part of this exam is going to have you manage diverse learners, and diverse does not necessarily mean ethnic. It could be second careers, it's adult learners, it's people that have different degrees and are transitioning to nursing. It is English as a second language learners. Diversity is big in this exam. I was actually pretty surprised. One of the things that I remember when I left the exam was thinking, wow, I had a lot of questions around how to teach diverse learners. And I had taken a whole course in my DNP on cultural competency and learning. And I thought to myself, I am so glad I learned those cultural nursing theorists because they were on that exam. And so again, thinking about how you teach and using theories is going to be on this exam. So cultural learning theories is going to be on this exam. The difference between academic and clinical, when we think about the academic setting in the CNE, we're really facilitating knowledge and dissemination, developing creative thought and student growth. Clinical provide high quality patient care, okay? So the CNE is really neat because CNEcl is you really kind of marriage both of those things. It's a neat certification. When we think about the academic setting, who is accountable? The academic setting, the student's accountable, and the university. But in the clinical setting, where your exam is going to be for the CNEcl, you're talking about the patient could be involved and the family, the clinical facility, and the student. So all those, and I bring that out because the stem of the questions is going to be in that realm when we think about the settings, okay? Student accountability in the academic setting is to their self, but in the clinical setting, you're really accountable to others. When we prepare students in the academic setting, there's different books, lectures, audiovisual, case studies, lab simulation. But in the clinical setting, we can use all different things. And again, this test is not just for academic clinical. We're talking about new grad orientation, novice learners, educators in the clinical practice. So another concept I think is kind of an important thing when we think about the clinical setting and your questions, it's really going to have, because the uncertainty and the ambiguity, the tolerance is very low. We have to have very high quality and safety measures in clinical. So this exam is going to focus on the safest practice that you're going to see. You're not going to be able to tolerate too much of the student's ambiguity. They're going to need to know what they need to know. So when we go back to this blueprint, again, thinking about how we demonstrate, we've talked about critical thinking is important. Learner development and socialization becomes a real big strategy here. Clinical education is really an art, right? It requires a lot of effort and practice and self-assessment. So when I talk about self-assessment with this exam, there is a piece of the exam that you need to think about when we talk about how does the clinical faculty get evaluated themselves. Okay, how do they improve their own teaching skills? One of the obvious things is they're taking the CNEcl, right? They're improving themselves because they're learning and they're having professional development. But that is definitely a piece to this exam, is how the clinical faculty improves their own practice. Critical thinking. I can't tell you enough, you really have to know how the faculty facilitates critical thinking in clinical. We have to know that anyways, but in terms of the exam, how does the faculty get the student to develop answers to the problems, okay? And that can be anything from identifying a low-level Bloom's taxonomy, identifying, describe, to something a little higher level, to not just identify, describe, but now you're doing prioritizing, and you are doing how do you prioritize something, how do you synthesize, you know, again, you have to understand the building of that Bloom's taxonomy to get to that critical thinking, clinical reasoning. Resources and sources that students use, evidence-based practice, absolutely have to embed clinical practice and evidence-based practice, asking students for reasons and seeking why did they make the decision that they made. In this exam, you are, as the faculty, if you are facilitating a conversation in the exam, a lot of times the student will say things that will alternate many alternatives to the solution, okay? And that is showing a sense of critical thinking, or identifying discrepancies, medication errors, near misses. Those are all quality and safety ways that we can introduce critical thinking. How do we measure competency? Okay, again, we talk about recall in the lab. How do you do a respiratory assessment? How do you insert a Foley? That's all about direct recall. When we think about other clinical competency and measuring, we can do peer evaluation. For this exam, you do need to know the different kinds of evaluation, and peer evaluation is absolutely one of them. Post-conference. Having a strategy with post-conference is important because, again, marrying those, that big buzzword, affective domain. In post-conference, how would you facilitate the affective domain? Well, that's all about thoughts and feelings. So the idea with that is to gain some, you know, emotion from the student. How did you feel today when the patient's family came in after the code? You know, what were the thoughts and feelings? And you're focusing on that one domain versus a cognitive domain is when the patient was coding, what were the steps that you did to initiate that process or something? It's really about being very cognitively focused and driven. Two totally different strategies. Case scenarios are great ways to develop clinical competency, as well as concept mapping. Now remember, in this test, again, you are going to have to identify your type of learners. So we have the VARC, right? The visual, auditory, receptive, kinesthetic learners. That is also in the clinical practice, believe it or not. I know we say we learn these things for the classroom, but VARC is very important for you to know for clinical. So when I talk about concept mapping is perfect for the visual learner. But if I'm an auditory learner, post-conference discussion might be better way to facilitate my learning. So you do need to, again, match those with the examples. It's all about examples. Okay. As we move into this last piece, and then we're going to give some time, I'm sure there'll be questions. I do want to spend the last few minutes talking about evaluation and feedback, one of the most important pieces. Remember, it's a good percentage of your exam, and it's a lot because it's one of the most challenging things that we do. And most people are not formally trained. And I'll tell you who's not formally trained is your preceptors. Preceptors do a great job with cognitive, psychomotor domain. Affective domain and giving feedback, that is an art. It's something that is learned. To be able to give somebody constructive feedback in a non-defensive way to get them to do better. Okay, that's really an art. So evaluation begins on day one, right? It's ongoing and continuous. And you will see questions around this, and what you need to very much differentiate, because it will get confusing on the test, is examples of summative and formative. Okay, if you are giving feedback along the way, there should be no surprises at the end, right? They should be working towards an outcome or a goal. Formative feedback, okay, again, feedback we give to students along the way, and the purpose is to help make that help the students achieve those goals. The purpose of me giving you feedback is to help you do better next time. You need to utilize this feedback so that you can meet the outcomes. Okay, it all is outcome driven. Okay, so we want to get the student to change along the way when we give them feedback. And if we do a good job, that summative, where there's no surprises, we're going to give you summative, a clinical course evaluation. And this is where we determine, did you meet the objectives or not? And those objectives can be, like I said, psychomotor, affective, all different things align the clinical objectives. And those clinical objectives, I always go through those on day one as I'm getting my students prepared. Now, a lot of times clinicals pass or fail, right? If you meet it, you pass or you don't. But a lot of schools are going to giving grades for clinical. But for this exam, it isn't going to be institution specific. This exam is going to focus, do you understand what formative versus summative feedback versus peer evaluation? Do you know how to get students in your clinical group to work together as a team and provide constructive criticism? And that's the first thing that you should be talking about on day one in your orientation, is we are going to critique each other in a non-threatening way. We are a team. We're here. We all have the same end goals. You're all junior level nursing students in this clinical rotation. These are our outcomes. These are our goals, and we're all going to work together to make it. So formative is a process, okay, and it predicts the summative. Summative is an outcome grading, and it sets the standards. Feedback is the key. Feedback, feedback, feedback. Because that's the one thing that the clinical CNEcl really focuses on, is how do we give purposeful feedback. Good feedback is specific, okay, and versus global. So you need to keep your patients on track during your interview. Well, what does that mean? That's very gray for the students, right? Versus your interview was terrible, right? That's very global. Oh my goodness, all over the place. Positive versus negative. Your hands are close to correct for the mobilization, but you will have better results if, versus your hands are not in the correct place, right? You can tell. How we give feedback makes a difference. And the students, remember, they're so stressed out already about you giving them feedback. Even if you're trying to help them, you've stressed them out before you've even started. Useful versus directed at someone that cannot be changed. Let's problem solve how you are going to do this technique because you seem to have difficulty. Versus, you can't do that technique because your hands are too small. What? Supportive versus judgmental. Well, 2 hours is rather long to do an eval versus I've never had a student who took 2 hours to do an eval, right? One is very supportive, one is judgmental. So those are just important ways that we want to think about giving good feedback to the learner. Fair versus based only on one incident. Oh, safety is the only exception to this, right? We know that students, we are looking for them to be in normal sinus rhythm. We are not, and I say that because we want them to have a P wave followed by a QRS, followed by, a perfect rhythm, regular all the time. They can have a little bit of AFib, but as long as they go back into normal sinus rhythm, we're okay. I don't want them going into VTAC where they're up, they're down, they're up, they're down, right? And that is where, we have to give them feedback, not based on incidents. So if I see them not being prepared 1 week, I expect the next week to fix that. But if then I find something else, then they're all over the map. They need to be consistent. Good feedback is honest versus obscured by attempt to protect the feelings. I always say, it's really important to just keep it objective. Keep your feedback objective. Looking at your clinical evaluation tool, we are not at the summative point, but I'm looking at these objectives, and I can see because you are not prepared to give medications each week, you will not successfully meet this objective. How are we going to improve it so you can have a pass on this objective? Based on firsthand information versus hearsay, right? You should always have your own eyes on the person versus what somebody else has said. Constructive versus given without suggestions for improvement. Example for that is when you get Mr. Smith out of bed, you should support his right leg versus used an inappropriate technique for getting Mr. Smith out of bed. Feedback is all about change, right? Focus on behavior versus focus on personality traits. When you enter a patient's room, it is important to smile and greet them versus you are too abrupt when you begin your treatments. Checked versus clarity versus improperly understood. Always ask your student to repeat what you said so you will know that they have heard what it is you want them to hear. I feel like this is something I have to do with my children, right? You always ask them, now, what did I say? What did you hear? What did we? Because sometimes what they hear is what they want to hear and not what you just said. So it's important for us to all be on the same page, and it has to be timely. Oh, your feedback, if you get a question on this, the feedback is always going to be in a timely manner. It's never going to be in a few days or a week. It's going to be right in the moment. Always maintain an environment for open discussion. Consider the physical environment, right? Where are you going to give feedback to the student is important. Privacy is important. Body language is important, right? Encouraging questions and cooling off periods. If the student gets too heated, it's important to de-escalate, right? Because they can get very defensive. And so you may see a question on the CNEcl that talks about how you can be sensitive and manage a student that becomes defensive so that they can hear what you say. We want to focus on the objectives and the behavior, right? Have a third party present if needed, and always practice, right, before you go into it. When we are giving feedback to students, it's important for them to know that we are both working to meet the goals. Okay, the goals are objective, they're not subjective. I didn't make them up, they're objective. And you can share your own struggles and challenges, because by sharing, if I give a personal story about when I was a student in clinical, I was so scared when I gave meds one time, I almost stuck myself. So I can understand where you're at, because when you're scared and you're shaking and that needle is moving, I'm afraid you're going to stick yourself. And that was me. I totally get it. That's okay. That's an appropriate thing to, on this test, you might see answers that reflect that. So in terms of a summative evaluation based on observations, it should be based on a typical performance, right? We have this thing called the norm reference curve. In that, we want to if the group is you've had this, a clinical group is very, very smart. So now you work really well one term, and then the next term you get a group that isn't as, prepared, or they're just not like the last group. You cannot evaluate them based on the last group. You have to evaluate them based on the competence that we are looking at for those objectives for that student. You always want to explain your reasoning. So we're going to start to wrap up. I have a couple examples of questions I want to share with you, but in summary, students need feedback. They need it in a timely manner, okay? If you get a question on feedback, it's going to be in a timely manner, and it needs to be so that there's no surprises, which is why we give formative feedback. Practice question number 1. Let's see how you do. Which statement by the novice educator indicates a need for follow-up by a mentor regarding clinical evaluation? I need to provide feedback on a regular basis about student progress. I should compare each student's weekly clinical performance with the weekly clinical learning outcomes. I should include frequent feedback for students on their clinical paperwork assignments. I need to determine if students' performance is a pass or fail for each week. So the question, going back to the statement, which statement by the novice nurse educator indicates a need for follow-up? So there are 3 correct answers and 1 incorrect answer. So I need to provide feedback on a regular basis. You should have flagged that as correct. I should compare each student's weekly clinical performance with the weekly clinical learning outcomes. Correct. I should include frequent feedback for students on their clinical paperwork assignments. Correct. I need to determine if a student's performance is pass or fail for each week. No. What does that tell you? Pass or fail is not a weekly thing. That should be formative. Formative in terms of we need to give them feedback so that the goal is for them to pass or fail at the end. Okay? All right. Which statement by the novice nurse educator indicates a need for follow-up by the mentor regarding precepted clinical experiences for pre-licensure students? The preceptor should meet our criteria for selection for the course. I need to frequently monitor the preceptor and student experiences. The preceptor will complete the student's summative clinical evaluation. I will ask students to evaluate their preceptors on their overall clinical learning. So the question is then asking you which statement by a novice nurse educator indicates a need for follow-up by the mentor regarding precepted clinical experiences. So we're looking for the incorrect response. The preceptor should meet our criteria for selection for the course. Absolutely. The preceptor has to meet certain criteria set by the school, their accrediting body. They may have to have a BSN. They may have to be specialized in an area. Who knows? But they have to meet criteria. They may need to have been a nurse for a certain amount of time. I need to frequently monitor the preceptor and student experiences. Absolutely, right? In a mentor relationship, the educator is going to monitor that preceptor. The preceptor will complete the student's summative clinical evaluation. Well, it might not be correct because the preceptor does not give a final, the preceptor does not work for the school. The preceptor works for the hospital and is facilitating an experience for your student. So they should not be signing off on summative final grades. They may be giving formative evaluations, but should not be summative. And I will ask students to evaluate their preceptors and overall clinical learning. Absolutely. We want to know what the evaluation of the preceptors are. Do we want to use them again? Last question, which statement by a novice educator indicates a need for follow-up by the mentor regarding precepted clinical experiences for pre-licensure students? The preceptor should meet our, oh wait, I did that one. Should I do that one? Oh, I think I did that one. Oh, okay, well that one is, we've already done that one. So, in conjunction, thank you for your time. I am a good teacher. The problem is they aren't very good listeners. I would like to open this up for any questions at this time. We have a few minutes, and I'm sure there are some questions out there. Feel free to put some questions in the chat box, and we'll start.
Kimberly, is it possible to take this exam and do well if I haven't worked in academia? I am a clinical educator at a hospital in an ambulatory setting.
Yeah, definitely. If you don't work in academia, it's definitely possible. I will tell you, a lot of the exam is embedded in curriculum, and it would behoove you to do some studying in academia in that area. So I definitely think you can't just go and take this exam without that study. But absolutely, I think it's the perfect exam because it's clinically based.
What is a passing score for the CNE and what is a passing score for the CNEcl?
It's the same. We're looking for that 76% on that test. So there's 150 questions and you should be getting 99 out of 150. And remember, 20 of those are practice questions.
How long would you take to suggest to prepare for this exam?
Well, I think it depends on, if you have just graduated with a master's degree in nursing education, I think if you did some good hardcore studying, you could take it within 3 months. I think if you have been out in academia like me, and I had not prepared for an exam for many, many years, although I'd been teaching, a lot of this exam, you do have to refresh on pedagogy and theories and nursing theories. And so I definitely think that if you aren't going to hardcore study every night and work out with the material, you definitely need to spend at least 6 months.
How do I know which exam to sit for? Do I sit for the CNE or do I sit for the CNEcl?
They're both rigorous and they're both, one is not better than the other. If you are planning to embed yourself in academic practice, then I would do the CNE. Like if you're going to be in an academic institution. But if you're a DNP, a clinical nurse educator, an adjunct faculty, and you have a master's in nursing education, I would highly suggest the CNEcl. First of all, it's like I said, there's a lot on the CNE that is not going to pertain to your knowledge base that you will have to study for, and that would be challenging if you don't plan to be in academia. So I think they're both rigorous exam and they're both very prestigious. So I don't think one is better than the other.
Do you think a novice nursing professor should take this exam? And if so, do you think he or she could be successful?
Yeah, I do. I actually think it's a great goal for a novice because you learn so much, and it's like you are able, if you're working as a novice teacher and you're studying this incredible, the Billings and Halstead book, and you're really immersing yourself in how to be a best teacher, it's a great way to do so. I actually, by studying for the exam and writing this course that I wrote for Sigma, I feel like I became a much better teacher because it just brought to light everything that I was always already doing, and it gave me, oh yeah, that's the cognitive domain. Oh yeah, that's a visual learner. It really helped me become even a better teacher.
Do you know if I can take the CNE and the CNEcl? Can I take that internationally?
I'm pretty sure if you go online, as long as you have the the testing center in your area. And so if you live rurally, you might not have a testing center. So I would go online and see where the testing centers are close to you, because if you don't live if you're, somewhere and you don't have those testing centers, that might be more challenging.
I have an MA and a PhD in nursing. Do you know if I can still take the exam?
You do qualify to take the exam. Yep, you qualify under, actually for the CNE, you qualify, absolutely.
Is there a practice self-assessment CNEcl exam?
There is not right now. We actually, you know, that's why I said there is the practice CNE, which does have some of those questions, and that will definitely help you, but there will be content on those practice questions that will not be on the CNEcl. So I would suggest we will be, like I said, rolling this course out, the knowledge for skill, faculty and skills development for the CNEcl. It's a great course to help prepare you for this exam. And actually, you can do the first part of the course now, and by the time you're ready, do the last 2 modules.
What would you recommend for strategies for success when you do not have a master's degree in education?
I think if you're teaching, if you don't have a master's degree in education and you want to take this exam, the best thing is really to, and if you're in the, say, the hospital environment, I don't know what environment this person's in, but you really, you know, honestly, I would find a mentor with this exam. Find somebody that is studying and work together and do questions. And ideally, I would find a friend that is in academia that can help you with this, because I do think that it'll be more challenging. It's just more abstract. So it would be helpful to find a friend that is in academia. So if you're an adjunct faculty, you have lots of friends because you're employed by a facility, an academic institution that has people there that can help you with this. If you're in a hospital-based setting, you still have friends because you know you have that clinical faculty that comes to your unit, and you need to pick their brain of who is going to be taking this exam, who's studying, because it's good to have study buddies with this exam.
Do you know what the cost of the exam is?
It's actually pretty expensive. I believe it is. It's so for the CNEcl, it's a little cheaper. If you're a member of NLN, it's like $300. If you're a non-member, it's $400. Everything's on the website. But I know places will reimburse you as part of your faculty. You know, if you have faculty funds or if you have funds, they may reimburse you for that.
Would you suggest taking both exams if you are in academia, or would you separate them and take one or the other? Which do you recommend?
If you're in academia, I would just take the CNE. You don't need to spend the money on both of them, honestly. I really, like I said, being a DNP, if the CNEcl was out, when I went to take the exam, I would have just taken that. But I felt like because I'm a DNP and I'm clinically based and I write books and stuff on clinical, I felt like I really needed to have the CNEcl. But if you're in academia, just do the CNE. Just do one test.
Do you happen to know when the testing sites will reopen?
I don't know that answer, but I would assume the Pearson VUE sites are open for other testing, so I would assume it should be soon.
Do you have to retake the test every 5 years to keep your certification current?
If you can submit a portfolio in lieu of that. So there's criteria on the website on that. So you submit, like, you know, you've kept up in academia, you've done some, you have to go by each of those NLN Educator competencies and demonstrate. And if you're working in academia and you're working on a portfolio anyways, it's very easy. I mean, if you're already doing that work. If you're not working in academia, you know, I would take a look at that to see if it's something you want to keep up with.
Okay. What resources do you recommend, and what test prep do you recommend when studying?
Right now, it's a little limited with the CNEcl. So, like I said, one of the things we're doing is you got to do lots of questions. Get the CNE, get a book that has lots of questions. And if you're going to do the CNEcl, really focus on that, those questions on the clinically based model or the clinical nurse, you know, educator. The Billings and Halstead book focus on the clinical piece. Linda Caputi has a great book too on clinical instruction. But the thing is, I've looked at a lot of clinical books and facilitating clinical teaching. The problem is with it doesn't give you that, it gives you the how-to, and here's the cognitive information. It doesn't really move you to application analysis, which is what the test is. So it can tell you how to be a good clinical instructor and give you the cognitive stuff, but without those questions to put it together, that's what you need to study for this exam.
Thank you so much to our presenter today for all this great information. Sigma is grateful that you took the time to share with this audience and look forward to hearing more from you in the future. As a reminder to our attendees, please submit the state or country you are from in the questions feature. We hope you enjoyed this webinar. Be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars and podcasts are freely available on the Sigma repository. Thank you for joining us and have a wonderful evening.